Hi everybody, this is Dr. Lewis at Coastal Wellness in Lisbon. We're going to answer one of the one of our questions that was submitted. It was something along the lines of how do I know the treatment is working? And this needs a bit of context, I guess, because this really matters. What is it that you are getting treated for? Is this a back pain, a neck pain? Is this a previous hernia that was diagnosed? Did you have surgery on your spine? Is this actually something that lends itself to chiropractic care? So I'm assuming the question is, how do I know that chiropractic care is working for me? And this is really also goal-oriented. So when somebody else comes to see me, we want to make sure that they're in the right place. Is this something that I can help them with? And if not, then we're going to send them somewhere else. Does this require surgery? Is this a lesion that requires some other intervention? But if it's related to, let's give the example of back pain. Somebody comes in and how do they know that treatment is working? Improvements in pain can be a really good sign. But if I just adjust somebody, we can create momentary changes in pain. But if we don't address the things that are contributing to that in the person's lifestyle, then most likely they're not going to notice improvements for too long if they go back to what they were doing. And if there's extreme imbalances in their life, or a lack of physical activity, too much physical activity, lack of prerequisites for the physical activity or the demands that your life asks of you. If you have a job that every 2 weeks you have to lift heavy boxes up over your head, but you have no shoulder mobility and you have no strength pressing overhead, that's something that we have to think about. We have to maybe improve your ability to do those things. And also, how do you know the treatment is working really is goals that we set here in the clinic together. Is it just pain? Okay, well, let's try to talk about the factors that influence pain. Let's try to modify some of those factors or some of those variables. Can we bring that pain sensitivity down with other factors? If it's just treatment in the clinic, is there any way, sometimes I do have patients who don't have a lot of flexibility in their life, and their only option is to maybe get some treatment once in a while because they work 60-hour weeks. They also have a family with 3 kids, a dog, etc. They just don't have any time, or they won't allocate time to it. Big part of the conversation is always, what can we do to modify these things outside of here? And the other thing is, yeah, we can make change in the clinic. We can improve your mobility. We can decrease sensitivity through adjustments, through soft tissue work, through corrective care. But ultimately, we want to find out what are the goals in mind here. What are we working towards? And that's the best measure of whether or not a treatment is working. Is can you get back to doing the things you want to do? And a lot of this is going to be on the patient's responsibility as well. The chiropractor serves as a bit of a guide, or someone that can kind of help you or hold your hand along that path, giving you exercises, symptom modifiers, and some of it is treatment, of course. But how do you know the treatment is working is really how do you feel, and are you able to do what you want to do? And that's a goal setting process that goes on here in the clinic as well. Hope that was clear, and keep the questions coming. All the best, everybody.